What are the greatest concerns regarding increasing resistance to antibiotics being seen in patients with gonorrhea?
Gonorrhea is one of the most really challenging bacteria, not just sexually transmitted infections, but bacteria in general. Over the course of the time that we've known about it, which has been for many decades, it's managed to evolve resistance to pretty much every antibiotic that we used as first-line therapy. It began with penicillin in the middle of the last century. It went on to tetracyclines, which we can no longer use. And then most recently, we lost the whole class of fluoroquinolones, including ciprofloxacin, ofloxacin, and levofloxacin, because of fluoroquinolone-resistant gonorrhea. The alarming thing that's been happening in the last 5 years is that routine surveillance of people with gonorrhea has demonstrated that we are now seeing strains, and an increasing number of strains, that show some evolving resistance to the cephalosporins, and particularly to oral cefixime, which is the go-to standard pill, single-dose pill therapy for gonorrhea. And that's really concerning because it means that we're not only losing our only widely effective oral regimen for gonorrhea, but it also means that we could see class-based resistance. And that means if we start to see resistance to ceftriaxone, then we're really out of luck for treating infections because we really have no other available antibiotics on the horizon right now. You can treat many of these infections, or you can treat people with cephalosporin intolerance or allergy with azithromycin of 2 grams. The problem with that is that we're also seeing increasing resistance to the macrolides. And actually there has been a single case reported in a woman in Hawaii who actually failed treatment with azithromycin because she had a highly resistant gonococcal isolate. So my advice for clinicians is to be very vigilant when you see a patient who you treat with a cephalosporin-based regimen, and you should be using parenteral ceftriaxone right now. Cefixime is only recommended as an alternate agent, so second line. To be very vigilant. If you see treatment failure, really suspect that you may see an antibiotic resistance strain. Of course, it could be reinfection. We don't do a very good job at treating sex partners, and you should be trying to do that as best you can. But know that resistance is out there, and I think, unfortunately, it's just a matter of time before we start to see the clinical impact of that unfortunate evolution.